Now it's time to bring you my perspective guest on the programme, and we're honouring today a true hero or heroine, Naomi Ohene Oti from Ghana. She is an oncology nurse specialist and head of nursing at Ghana's National Radiotherapy, Oncology and Nuclear Medicine Centre. As if being a nurse wasn't enough of being a star, she's just been named the winner of the Aster Guardian's Global Nursing Award. The award aiming to recognise and celebrate the extraordinary contribution of nurses across the world. Firstly, congratulations to you. Thanks very much for joining us on the programme. I see you've got your award sitting there in front of you. How does it feel?
Thank you very much and good morning to your listeners. It's quite humbling, deeply emotional to stand on the world stage to be given this award. I would say it's not just a mere recognition or my only recognition. It is to the resilience and the dedication and the potentials of nurses across Ghana, Africa, and the world.
Yeah, it's lovely. We're watching some images of you. We're watching some images of you there as you heard that you won. I mean, why do you think you were singled out for the award?
Maybe in terms of my what I've done across the years and the impact it has, it has been, and the whole, my whole career journey and the impact has in health outcomes in our patients and also our colleague nurses within Ghana and beyond. Yeah.
So what do you...
In Africa.
Tell us a bit more about what you actually do then on a daily basis.
Okay, so currently I'm the head of nursing for, I would say, the Premier Cancer Center. So in Ghana, I do supervision, also engaged in the work. I'm an oncology nurse specialist, so I see patients, especially during the complex problems. I'm there to solve those issues. Also, I do administer chemotherapy when they need be, especially the complex ones. Also, manage symptoms of our patient, the cancer patient. Apart from that, on the global front or the international front, I'm also an oncology nurse expert for a lot of programs to be able to spearhead cancer nurses' voice across the world in terms of capacity building. CCAN, I'm an oncology nurse expert for the City Cancer Challenge and also ASCO multidisciplinary training programs. I'm also a past vice president for AOTIC, African Organization for Research and Training in Cancer Care, also pushing the oncology nurses' voices, led the development of competences for cancer nursing for Africa.
It's an incredible CV. It's obvious you work extremely hard. I mean, tell us a bit more about healthcare in Gaza and in Ghana and access to it. I mean, is there still a long way to go, would you say, to make things better?
Oh, healthcare in Ghana, it's better, but there's more room for improvement. We're saying access, a lot of access. We're having a lot of hospitals. But, Ghana is also faced with the brain drain, where we are having our nurses migrating for greener pastures because of economic hardship. Nurses are very hardworking, but because of economic hardship, others have to go and seek greener pastures. But I think we need a stakeholders engagement. The government is trying as much as possible for all of us to have universal health coverage. And there is we're training specialists. The Ghana College of Nurses and Midwives is trying as much as possible to be able to empower nurses with more sophisticated skills so as for them to have new challenges, new horizon, so as to help them give their best so in wherever they are. And this is helping in decentralization of, especially in cancer care, decentralization of some cancer services. So we are not there yet, but we are the country is doing their best as much as possible to be able to help this universal health coverage to be realized. So they are doing more, trying, their plans are in. We have only 2 main cancer centers, and there are plans in expanding to other teaching hospitals so as to be able to help in more decentralization. Our nurses, oncology nurses, nurse specialists that have been trained are helping in some form of, as I said, decentralization of cancer care.
What advice would you give to other people? If I can just interrupt a second, what advice would you give to other people? I mean, there may be people watching who think, you've inspired them, if you like, to take up the mantle and perhaps want to get into nursing, or they want to move further in the jobs that they're doing at the moment. But also to authorities and to governments that make decisions about, where money should be allocated. What would you say to them?
Okay, to the younger people, I'd say nursing is not just a calling; it's a social justice. And it's very important that when you come in, irrespective of people's background, you are supposed to give the necessary care that you need to give. And also you need to be well equipped and knowledgeable to be able to do that. And so stakeholders and governments are pushing, as per the WHO strategy for nursing and midwifery. They are employing all to invest into nursing. I think when we invest into nursing, we are going to reap the benefit thereof. There will be health outcomes will improve. They said that nurses are the heartbeat of a healthcare. So when they get it right, then the system also will get it right. So then there's a need to invest into nursing and support them, protect them, so that at the end of the day, they are well equipped to be able to deliver quality care to the patient, and patient will have a better outcome. So it's very important that we invest into nursing. We also take care of them. Safety, I think the international, the state of nursing report, it's saying that nurses need to be protected in their workplace. And there is a need for all to come together to protect nursing. So if they are safe, they will be able to deliver the needed care to the patient so that we have improved health outcomes.
Thank you very much for being with us on the programme today. Great to see you there. Great to see your award as well, Naomi Ohene Oti, joining us there from Accra in Ghana. Thanks very much.